Good morning, students. Today we will learn about the breastfeeding, correct position and technique of the breastfeeding. Okay. So, in previous lecture and how a woman breastfeed to their children. Okay. So, today we will learn about the correct position and techniques while giving the breastfeeding to a newborn baby. So, first of all, we'll start about the step that following by mother to while feeding her baby. Okay. So, first step is a find a comfortable position for yourself. So, mother have to proper position while giving the breastfeeding to the newborn baby so that the back pain and problem of the back may relieve by the proper position. Okay, then you may lie down, sit on the chair, on the table, or on the floor, feed your baby. So mother can apply this kind of the position like lying down position, sitting on the chair and on the floor while giving feeding the baby. Okay, so most important is that you must feel comfortable and your back must be supported. So this is the main aim for the proper and comfortable position taken by the mother, that is the prevention of the backache problem and comfortable by proper position. Okay, so this is the step first following by the mother. So mother can convenient and baby can also convenient for the feeding. Okay, next step is a next step, that is hold your baby in your arm so that her head and neck rest in the bend of their elbow. Okay, so mother taking the baby on her hand. Okay, so in mother's arm the baby head is lying and neck rest in bend of their elbow. So mother supported by her elbow and arm for proper position of the baby's head and the back along forearm and the buttocks in your hands. If you are feeding on your right breast, your right arm should be used to cradle your baby. So if mother taking the baby in right arm, so the right breast feeding is occur. Okay, so it is easy for the mother as well as the baby. If mother feeding by the right breast, then the right arm of the mother should be supported for the baby's head. Okay, so this is the following step by the mother, that is second two position of the baby also. Cause in first step that is position of the mother, in second step position of the baby and mother's arm. Okay, step third, that is turn the baby's entire body towards yours so that the baby's tummy touches to your tummy and the baby's head and neck should be supported. Okay, so this is the most important, that is the supported of the baby's head and back, because if baby's head is too if baby's head is not proper, then he or she can't taking the proper feeding by the mother's breast. So turn the baby entire to the mother's body so that baby's tummy and mother's tummy is touch. Okay, and the rapport will be maintained by the mother as well as the baby. Bonding between the mother and baby will be maintained. Okay, and head and neck should be supported by the mother's arm. Okay, and head. That is the step 3. Now step 4, raise the baby to the level of your breast so that the baby's mouth can easily reach the nipple and the areola. We already learned about the anatomy of the breast, and in that we learn about the structure of breast, that is nipple, areola. Okay, so when baby while mother is feeding to that baby, then the baby's level baby raise the baby up to the level of the mother's breast so that baby's mouth can easily reach to the mother's nipple and areola, so that the nipple attach to the baby's mouth. Okay, so that baby can easily feeding. Then this could be made possible by putting a pillow below your arm or raising your thigh if you are sitting cross-legged on the floor. This is only possible when a pillow or pillow will be pillow supported to the mother's arm or baby's position is the rising to the up to the level of the mother's breast. So this is the step 4. Okay. Next, make sure that the baby is not exclusively clothed so that the baby can be brought really close to you. And sometimes you may need to tuck your baby's arm away so that it doesn't come in the way. Okay. So if obstruction into the baby feeding, then baby will be disturbed by the feeding, and the arms baby's arm will obstructed to the feeding. Okay, so the baby's arm away from the baby's mouth. Okay, then you may use your free hand to hold your breast or to fondle your baby once your baby is really attached. Mother should be checked that is the baby is feeding or not, because if once she once a baby feeding, then the mother feels that the baby is feeding, but actual feeding is not there from the proper breast, and so that the mother can also hold other hand on her breast so that the milk is secreted easily. Okay, so that is checked by mother while baby is feeding. Then step 5, when the nipple touches to the baby lips or neck, your baby's mouth will be reflexively open to draw the nipple and part of the areola into the form of a teat. Okay, so while baby is feeding by the lips or cheek, okay, nipple touches into the baby's mouth, then reflexively open the nipple. Okay, and each nipple and areola form a teat. This is known as the attachment to the breast. Once the baby's mouth is open and touches to the mother's areola and nipple, then baby can feed easily, and that is known as the attachment to the breast of baby. The lactiferous sinus, which are storehouse of the milk, are situated beneath to the areola. Okay, so the lactiferous sinus is known as the storehouse of the breast milk that are situated to the beneath to areola. So to effectively suckle milk from the breast, both the nipple and areola should go into the baby's mouth. Now, in baby's mouth, nipple and areola touches, so the attachment will be there and baby can feed easily. Proper attachment is the key to successful breastfeeding, and improper attachment is responsible for most of the problems related to the breastfeeding, like sore nipple, congested breast, and inadequate milk supply. In some cases, this kind of the cases, sore nipple, cracked nipple, congested of the breast, okay, then inadequate milk supply. In this kind of the cases, baby can't feed properly or improper attachment is there. So baby will be disturbing by feeding. Okay. So mother have to check the while baby is feeding proper or not. This is about all steps of the breastfeeding. Now body position. So the mother should feed her baby in any comfortable position, such as lying down or sitting with a good eye-to-eye contact maintained between the baby and mother. Then good and bad body position are shown in figure. Now you will easily get the point by the figure. Okay. So in first figure, this is the correct position of the baby as well as the mother. So the baby and mother eye contact is maintained and proper attachment of the baby's mouth into the nipple and areola. So baby can feed easily. And in position B, you may found in this figure that is improper position of the mother and baby. Okay. So baby can't feed properly by the mother's breast. Okay. So this is the difference between the correct position of the mothers and baby. Now the description of the figure is given here, that is good position is maintained into the figure A, that is baby's head and neck is straight or bent slightly back and baby's body is turned toward the mother. Okay, as I told earlier, that is the proper turn body towards the mother. Okay, so that is maintained here, and the baby's body is close to the mother facing breast. Okay, so the baby's mouth can easily suck the breast milk by the nipple and areola of the mother's breast, and baby's whole body is supported by the mother's hand, and mother and baby eye contact will be maintain. Okay, so this is the description of the peak A. Figure A, that is we already discussed. And in peak B, bad body position, because baby's head and neck not straight, and baby's body is turned away from the mother, so the mother and baby's attachment is not that, and baby can't feed properly, and baby's body is away from the mother and not supported by the mother. There is no eye contact also maintained between the mother and baby, so this is known as a bad body position. So the mother can't proper care or feed to the baby, and baby can't feed by the mother. Okay, so that is no attachment between the mother and baby. And in this also you may this is the position by giving the breastfeeding. So first position is the cradle hold. So mother's arm of the uh, proper breast, if mother feeding by the right breast, then the right arm will be supported on the baby's head. Okay, so this is the cradle hold. In second one, that is the cross cradle hold. Okay, and last one is the lying down, and this is the football hold. So this can be helpful into the who has a twins baby. Okay, so this is about the correct body position and techniques while feeding to the baby. Okay, so proper attachment is the maintain. Attachment refers to the emotional connection between a patient and her infant, and this attachment is very necessary between the baby and mother. So it is a reciprocal both for the mother and infant. Exhibit attachment behavior. The infant respond to patient by cooing, grasping, smiling, and crying. So this kind of the infant's emotional status also shown to the mother. Okay, so in this figure it is described that is proper baby's mouth is goes into the mother's nipple and areola. Okay, so this is about today's session. We included in that the proper position, correct position while feeding the breastfeeding to the baby. Okay, so by here I will stop. Thank you.